I am here with Dr. Ernie Bagnulo, who's down here with us in Austin, visiting from Niagara Falls, Ontario, Canada. Dr. Ernie, thanks for being here.
Thank you, Garrett. It's a pleasure.
And I'm excited to give him the opportunity to share some of his experiences using the NEUBIE so far. So he's had it for how long up in your practice?
We purchased it last May. It's now December, so we're about 7 months in.
Okay.
And the evolution and revolution has been incredible so far with the patients that we've used it on, the results we've seen. It's really changed the way we do things in our practice for the better.
Nice, nice. Can you tell me, I know we've talked a little bit about some of the outcomes. Can you share some of the just examples of some of the successes you've had in terms of patient outcomes?
So a lot of difficult cases, things that would otherwise take months, from weeks to months to materialize into some positive outcomes, have gone down to weeks. For example, things like adhesive capsule issues, which can sometimes be troublesome, multifactorial problem there, to chronic low back pain, radicular back pain. Even in my own case, I had a procedure in the summer that I was back at work within a month when I told it would be up to 6 to 8 weeks. So the testimonial is personal as well. It's a natural, implemented quite well into what we did naturally, because we were already working on a neurofunctional model in our practice where the NEUBIE was just very natural to implement in, and we still practice the same we do, yet we do more now with the NEUBIE as well. And we've created a buzz, so to speak, and rekindled the excitement in the clinic, and
Nice.
Patients want to experience it. It feels great, and we're only at the tip of the iceberg right now.
Awesome. And so we're down here at our course, and you've got a few colleagues with you.
Yes.
So we get to use it more, right?
Yes. So it not only did it create a stir with patients, it created a stir within our own staff. So I'm one of 4 chiropractors at our clinic, and there's 3 other physiotherapists, and they're all wanted to get on board with what this was doing too, just because of the excitement it created. So I brought them down with me here, and they're pleased with what they see so far, and they're ready to implement it as soon as we get back on Monday.
Nice.
Very good. Yeah, no, it's great stuff. I mean, it's about staying ahead of the curve and getting things and doing, most importantly, doing well for the public and the patient base that's coming in. But the proof is in the pudding with the product and the results.
Awesome. And you had mentioned a couple examples of new referral avenues or different things that it's opened up for your business too.
So, family doctors, we've reached out to some of the family doctors and specialists in our area and tried to sit down and explain what it is, because it was foreign to them. We've used social media to really push it. We really believe in that as a promotional aspect for anything that we do for the clinic. But the patients, word of mouth, once someone's tried it, someone's come in right away and said, so-and-so did this, and they talked to me about it, and I want to try it because they had such good results from things as simple as difficult hand stiffness and achiness to patients who couldn't get out of bed. Like I said, we've only been using it for 6 or 7 months. I mean, I can't even imagine what's ahead, because the results have spoken for themselves. But patients love the experience because it is comfortable. They almost enjoy the anticipation of the machine, and as we turn it up a little bit, so how far can I go? It becomes a game of sorts, but we try to obviously rein it in so it's within therapeutic parameters. But it really is it's created excitement in our not only our clinic but the small community that we're in too.
Awesome. We love it.
And I just wanted to mention that the knowledge base, even not just the machine itself, but the knowledge base that coming down to the course and actually getting the hands-on work here in Austin has been influential in the way we've been to implement it correctly, because you can get the machine and play around with it, but but we've been able to actually fine-tune it, the results got even better than us just trying to do it on our own too. So
Nice.
Being down here was huge for learning purposes.
Awesome. Very good. Thanks so much for sharing that. We're fired up to be
Thank
working
you.
with you.
No,
and,
absolutely, and we're pleased to be one of the first in the north of the border to bring it to the patient base up there.
Oh, Canada.
Yeah, and a big country it is.
That's good. Yeah. Thank you.